Hi, I'm Ashley Argent. For this review, I looked at current studies on musculoskeletal injuries in nurses, the risks that contribute to them, and which interventions have the strongest evidence for prevention. For this project, I really wanted to focus on newer research about musculoskeletal injuries in nurses, especially when it comes to patient handling and workload. My main question going into this was pretty simple. What does the latest evidence say about why these injuries keep happening and what actually helps prevent them? I choose studies that looked at the real day to day demands nurses face, like patient transfers, physical strain, and the impact of ergonomics. The three articles I used were by Luna, G, and Yang. Each comes from a different quantitative design, which I liked because it gave me a fuller picture instead of relying on just one type of data. Before getting into the articles, I wanted to give a little background on why this topic matters. As nurses, we deal with a lot of physical strain from lifting, repositioning, and long shifts. Because of that, work related musculoskeletal injuries are extremely common. In fact, over 200,000 healthcare workers get injured every year, and nurses are one of the highest risk groups. These injuries don't just cause pain, they lead to burnout, missed work, and can even impact patient safety. What stood out to me is that we still see these injuries happening even though most facilities provide equipment and training, so the problem isn't solved yet. That's why it's important to look at the actual risk factors and see which prevention strategies are truly effective. Understanding that helps protect nurses' health and improves the care we give. Before diving into the individual studies, I wanted to explain how I chose my sources. I focused on newer research that looked directly at musculoskeletal injuries in nurses, especially the parts related to patient handling, workload, and physical strain. I also made sure the studies came from different quantitative designs because that gave me a more complete view instead of relying on just one type of data. Luna, G, and Yang each looked at the problem from slightly different angles, which helped me compare how injuries happen, why they keep happening, and what actually prevents them. Article 1 is by G, published in 2025. Their study looked at injury risk during patient handling task. It's a level 5 quantitative descriptive study that used a mixture of quantitative, correlational, and observational methods. They used motion capture technology along with digital human modeling to measure lumbar forces on healthcare workers during a routine bed transfer between stretchers. This let them look at real time body movement, posture, and force patterns that could contribute to musculoskeletal injury. For the main findings, they discovered that lumbar load was highest during the pulling and pushing phases of the transfer. Trunk flexion and body height had the strongest influence on how much force was placed on the lower back. They also found that when partners were mismatched in height, spinal loading increased. Gender differences showed that females tended to pull with higher force while males generated more force during pushing. These findings support training focused on neutral spine posture, pairing staff with similar height, and helping staff control trunk flexion during transfers. For the second article by Luna and colleagues, the researchers looked at how a nurse's daily activity level relates to musculoskeletal symptoms. This was a correlational quantitative study, so they followed nurses during their normal routines and compared their step counts, shifts, and symptoms. What they found was pretty clear. Nurses had more symptoms on work days compared to days off, and the discomfort built up the more days in a row we worked. Symptoms also tended to peak later in the day, especially around 6 o'clock. Longer shifts and missing lunch breaks were linked with more pain, while even simple bathroom breaks gave a small amount of relief. Nurses with a higher BMI had higher symptom ratings, and even though nurses walked way more on work days, that activity didn't reduce pain. Very few nurses experienced outside of work probably because the shifts were already so demanding. For gaps and limitations, the study showed that high step counts didn't actually improve health, and work activity didn't protect pain the same way normal exercise does. It also had a small sample and only captured 1 week of data, so we have to be cautious about generalizing it. Overall, the results highlight that nurses experience a lot of physical strain with not much recovery time. It suggests that better break availability, more reasonable shift structures, and stronger ergonomic support could help reduce symptoms. The main takeaway is that physical activity at work isn't the same as beneficial exercise, so nurses still need recovery time. Next is Article 3 by Yang and colleagues. This was a quasi-experimental study looking at multidimensional intervention program for ICU nurses. The intervention actually worked really well. Nurses reported less pain at 3 and 6 months. They showed better ergonomic habits, and there was more use of lift devices, which lowered their overall injury risk compared to the control group. There were some limitations, though. The sample was only ICU nurses. The follow-up was fairly short at 6 months, and the study relied on self-reported symptoms. It also takes real resources and equipment to roll out this type of program. What this article really shows is how vulnerable structured, safe patient handling programs can be, especially in high demand units. Investing in ergonomic training and lift equipment can protect nurses' musculoskeletal health and reduce injury rates. Units that do a lot of heavy patient transfers like ICU, med-surg, or long-term care could benefit from adopting similar programs. Strong prevention strategies don't just reduce injuries, they improve retention, lead to safer patient care, and lower worker compensation costs. After reviewing all three studies, the overall message is very clear. Nurses experience a high amount of physical strain, and musculoskeletal symptoms are incredibly common among different settings. Workload, long shifts, and limited recovery time makes these issues worse. But the research also shows that the right strategies really do help. Safe patient handling programs, ergonomic training, and consistent access to lift equipment all lead to fewer injuries and less pain. These interventions support both nurse safety and patient care. For future research, we need longer studies that follow nurses over time to see if these improvements last. We also need a research that includes more types of units, not just ICU or med-surg, so we can understand how these strategies apply across the nursing workforce. All references used in this review are listed in the final slide in APA format. Thank you.